many years, but particularly over the last several months as we have dealt with the event that is COVID-19. Now, I know that this will not be popular in the national media, but I will tell you that I have been very impressed with the federal response. People want to gloss this over, but this is a fact. No American has died from coronavirus because our hospital system was overwhelmed. In other countries, they ran out of ventilators. In other countries, they ran out of ICU beds. In some other countries, they ran out of beds altogether, but not in America. That's largely because of the leadership of President Trump, Vice President Pence, our coronavirus task force, and our quick response by the United States Congress. That simply doesn't get said enough. People shift the goalpost, and they'll find a new way to attack the president. But I really think President Trump deserves our prayers, our gratitude, and our support. The same is true with our senators. They have done a tremendous job on the response. They have passed 4 different pieces of legislation, the largest one being obviously the CARES Act. That legislation has given us as governors across the country the resources we need to manage this emergency. There are other conversations to be had, and I support the leadership of our senators. The CARES Act provided help for small businesses through the Paycheck Protection Program. It is helping Mississippians to survive the economic damage with stimulus checks. Our senators have advocated for Mississippi every step of the way. I'll just give you one example. Early on in this process, we sat down with our Mississippi Department of Employment Security and talked about the various things that we as a state needed to do to respond. One of the things that is in Mississippi law, which I think is a good thing in normal times, is that prior to being able to apply for unemployment assistance, you have to have been off work for at least 1 week. Because we knew there were going to be tens of thousands of Mississippians that were going to be let go through no fault of their own because of the government taking action, we decided early on to waive that 1 week requirement. In the CARES Act, because of the advocacy of our senators and those throughout our country, the federal government has decided to pick up the tab for that extra week. That is just one small example of all of the things that they have done to help us. Now, there are a lot of people who want all of our resources at the federal level to just go to big states with big cities. But our senators have been champions for our small town way of life. They care about our people, and it's evident to me in their work. Now, we currently have a lot going on at the state level. We delivered 860,000 masks to all 82 counties just yesterday, 1,200 gallons of hand sanitizer, over 1,000 containers of disinfectant wipes just yesterday. All of that is because our senators have secured the funds for states to pay for all of these unprecedented expenses. I invited them here today to provide an update for the people of our great state on all of their hard work, and I'm honored that they accepted my request. At this time, I'm going to turn it over to our senior senator, Senator Roger Wicker, for an update.
Thank you, Governor Reeves. I appreciate the invitation to be here and also the invitation to be present with my colleague, Senator Cindy Hyde-Smith. It's great to be back together. I'll begin with a brief report on the CARES Act. The CARES Act was signed into law March 27th. It's hard to believe it was only 1 month and 2 days ago that this law was signed by President Donald Trump. This new law is giving businesses large and small resources to keep workers on the payroll. For small businesses, much of these loans will be forgiven. For larger businesses, we expect them to be paid back over time. For those Americans who already lost their jobs, we expanded unemployment insurance to help them through the pandemic. And we provided direct financial assistance for most working Americans. We decided this was the fastest way to deliver relief to people with the least amount of bureaucracy and red tape. The CARES Act was the largest bill ever passed by the United States Congress, and it was implemented in record time. That is not to say it's all gone perfectly. There have been some frustrations and hiccups and stumbles along the way, including the need for more money on the Paycheck Protection Program, which we passed last week. But overall, President Trump and his administration deserve great credit, as does Governor Reeves. We also need to continue providing effective oversight of these new programs to make sure the money is spent efficiently. The Senate will be back in session on Monday of next week. The House will return to Washington later. But there are a number of items the Senate can do on its own, and we'll begin to do that next week. We need to confirm the President's nominees, including several nominees who will help with the COVID-19 response. We also should confirm more lifetime appointments to the federal bench. There are 3 vacancies that need to be filled for Mississippi. Our committees will be working on issues such as water resources and infrastructure, including rural broadband, and we need to resume work on the annual appropriations process. A lot of attention has been given to China during this discussion, to their conduct and misinformation campaign during this crisis. But we also need to keep in mind that China is continuing its military buildup, and so are our other adversaries around the globe. With that in mind, I'm leading an effort to prevent cuts in our defense spending and to protect defense manufacturing, including aircraft manufacturing and shipbuilding. This will be a good investment for our national security as well as for the thousands of small businesses and the millions of Americans that make up our military supply chain. And we have more to do. Even with the massive efforts we've taken to date, the economy is still losing billions and billions of dollars each month during the shutdown. That's why it's so important that Americans get back to work. And as we do so, let me emphasize this. Reopening the economy does not mean ignoring the virus. We can and should be smart about the pandemic while getting back to work. Governor Reeves understands this balance, and he's taking the right steps. For example, the governor's executive order last week included the resumption of elective medical procedures with precautions. This was the right call, Governor, and will be a boost to our hospitals, which need the revenue, not to mention to sick people who needed the elective procedures performed. The governor rightly trusts doctors and healthcare providers as capable of making these decisions. So thank you, Governor, for that. As we reopen and recover, we need a huge expansion of testing. Congress appropriated $25 billion for testing last week. We need to be able to test Americans on a large scale so that we can isolate those who are infected and the rest of us can return to work safely. Mississippi has done a good job with testing, but we need to ramp up this effort across the country. We all need to do our part. If we do, I know we will overcome this just as Americans have overcome every previous challenge to come back better and stronger than ever before. Thank you, Governor.
Thank you, Senator Wicker, for your leadership, not only your leadership for our state, but your leadership of our nation. At this time, I would like to ask Senator Cindy Hyde-Smith to also address Mississippians. Senator, thank you for being here.
Thank you, Governor. Thank you so much for the opportunity that we can come here with press and have the audience that we have that's listening throughout the state. You know, no one could have predicted that the position that we're in right now, but I think you've done a great job of handling that. To work with Senator Wicker has just been a pleasure. I tell you, his office has really stepped up. Our staffs are working 24/7. They are nonstop fielding calls, and along with many federal agencies. One of the things when this first started that really concerned me, because I grew up in a rural area, is the rural hospitals. And, you know, the health care that has just been provided there during this trying times when everybody is so afraid. They're afraid for themselves, they're afraid for their families. And the least cough, the least sniffle, they're so concerned that they may be testing positive for COVID. And so the rural health care has been really important, and I stay very close to mine. The two of the things that I have been very pleased with is we had a conference call this morning with Secretary Azar, Health and Human Services, and one of the things that they have already done before today, they agreed to set aside $10 billion specifically to help rural healthcare providers. And that money should go out to the rural healthcare workers in the hospitals either the end of this week or the first of next week. The second thing is some of our county-owned hospitals were not covered under the Paycheck Protection Program. So the Treasury amended its regulations to make sure that our small county-owned hospitals are eligible now for that. There's so many issues that pop up, and I've had the opportunity to speak with nurses on night shifts that they were afraid, not only for their patients, they were afraid for their lives. And to think about those suffering from COVID and to think about those who are treating those patients that are suffering from COVID. This has been a huge challenge for Mississippians, but I could not be more prouder for our state in the way that it's been handled. To look at the University Medical Center, they came up with their own ventilator, how innovative that was for them to do that. In Forest General and Hattiesburg Clinic and with USM to come up with their testing kits, that is just saying we're not depending on government for everything. We're stepping up and using the resources we have to handle this as well. And at Mississippi State, when we had the portable ventilators, and they transferred them to electric ventilators that they could plug in, Mississippians, as usual, they've done a fantastic job at heeding the advice of the CDC, of not looking for government for absolutely everything, but helping themselves and helping our state. Could not be prouder of that. And of course, we have the $310 billion for the SBA Paycheck Protection Programs. How many small business owners have I talked to that this has been their saving grace? It is not perfect. The CARES Act, I assure you, is not perfect in any way. But to be given the circumstances that we were given when we were in Washington, D.C., before we left to come home to deal with this in our home states, the magnitude of that and the way that we put it together through people who are able, people who are very competent, prudent people, to come up with that plan as massive as it is, it's worked pretty darn well. I can assure you, I've been so impressed with the calls that we've gotten to say, we have hiccups, we've had errors, we've had things, and thank you for making sure that it was there. It's our job, Senator Wicker and my job, is to get the money to the state of Mississippi, to get it throughout the country, to make these decisions. But we cannot depend on government for everything. We can't keep shoveling money out and expect the basic fundamentals of economics to work. We know we have got to get this country going again, but to be there, to be part of that, to construct the legislation and trying to consider every caveat possible to make sure that when we came in, we know we were on the beginning stages of this, but to roll out these phases that we've rolled out in the timely manner that we've rolled them out is pretty incredible. You can be a proud American when you look at that Capitol and you realize, this was unprecedented beyond the meaning of unprecedented. But we stepped up and we made sure that we came out with a plan that the states can continue. So proud of President Donald Trump and his staff, the leadership that he has shown, the duress that he has had to endure during this time, but continuing every moment, literally night and day, to make sure we have the things in front of us that we need. On top of all of this, the Easter tornadoes. The governor was so gracious in allowing me to fly over the tornadoes where the damage occurred in southern part of the state, and then having another 2 tornadoes at one time, and then having another one to follow after that. The devastation of that on top of COVID, I assure you, when we landed and put on our mask and we were looking at the people that had just lost their homes, they really weren't worried about COVID during that time. And to think of the challenge that has been for Mississippians, and the way the governor got the relief package started and got the declaration signed. And, that's going to go on for a while. That's not going to end very soon, just like with the opening of the country. I've said all along, the worst thing about going through this, as bad as going through this, would be going through it twice. And to look at the way that we're handling this, the way we're getting the message out through our Department of Health, through Dr. Dobbs, who has done a fantastic job. But people, the Mississippians, you've got to continue to listen. The virus is still out there. It is still real. Our numbers today were over 200 new diagnoses, and we had more deaths yesterday. So it is still there. We're living in a new world, and I think we're going to be changed forever. I don't think we're going to go back to business as normal, and we don't need to go back to business as normal because it is there. We're still under a significant threat. We do not need our healthcare centers overloaded. We do not need a resurgence and another occurrence to come about with making things worse. We need you to continue to practice those safe cautions, to continue to wear masks when you can, to wash your hands, all those sanitation things that we've just been so well reminded of. We've learned a lot of lessons, but guys, when we move forward, we need to continue these lessons. We need to continue getting on the other side of COVID-19. We need to continue these practices. This economy is going to rebound. It's going to come back, but it's because we're doing the right things. I just ask, beg, and plead that we continue to do those practical, safe things. Business owners, when you open up those businesses, don't let crowds come into your store. You're going to have to enforce these regulations. Everybody wants the economy to start back. Everybody wants to get back to business as usual. But we can do this together. God is sovereign. We're going to get on the other side of this. And one of the things that my family has started to do is when we pray before we eat, I always say, first thank God, then thank a farmer. Now I'm adding the third thing to that. Let's pray every time we start to eat, because we do that real regular, that we have God's guidance with this virus and that we can continue to get on the other side of this. Thank you for this opportunity, and we are certainly here in my office. My staff is willing to help anyone that has an issue. You call my office, and we will be there to assist you. Thank you.
Thank you, Senator. The very first call that I had regarding COVID-19 with President Trump, he made it clear, and Vice President Pence has made it clear in every call we've had since then, and there have been dozens. In every call, they recognize that the federal act that has always handled disasters in this country, the Stafford Act, contemplates that these natural disasters, these disasters that occur, are state-managed, locally executed, and federally supported. And what I can tell the people of Mississippi today is these two senators and our members of Congress as well, our House of Representatives, they could not have been more supportive. And President Trump and his team could not have been more supportive of what we're trying to do in our state. They made, for instance, Dr. Birx available to us last week to have a call to talk about our data and talk about our numbers so that we could make sure that everyone knew what we were seeing and why we were making the decisions that we were making. And we got confirmation that we're doing the right things in Mississippi. But when we talk about federally supported, these two could not have been more supportive to the people of our state. And I just want to personally thank both of you very, very much. Thank you.